Welcome back, ladies and gentlemen. You're still watching The Breakfast Show, and as I mentioned at the beginning of our breakfast show today, that we're going to talk about the health sector in Egypt, which witnessed unprecedented development witnessed by the health sector and services provided to the citizens in recent years. And to shed more light on this issue, we are delighted to have with us in the studio Dr. Maryan Guirguis. She is a journalist. Thank you very much, Dr. Maryan, for joining us today.
Thank you. It's my honor.
Dr. Maryan, the WHO certified Egypt as malaria-free in October 2024, and this milestone was the culmination of concerted efforts by the Egyptian government. Tell us more about this.
Yes, let me in the first beginning say that the efforts done through the health sector was many through the past decade.
Yeah.
And actually we have seen many efforts from the Egyptian government in the health sector in believing that the health and the quality of life is very important for the Egyptian citizens.
Yeah.
Let me talk about the communicable diseases like malaria, like the trachoma, like many diseases like the lymphatic filariasis. Actually all these communicable diseases, many of them and lots of efforts were done to eradicate and to eliminate these diseases. In 2018 the lymphatic filariasis was the first communicable diseases prevented or totally eliminated and eradicated from Egypt. Preceding after this malaria in 2004, and it was very old disease. It was old like as old as the ancient civilization. Even in the mummies, in the pharaohs, there were traces.
Malaria.
Yes, they detected malaria, and traces of malaria were found in these mummies. And actually, the hygiene and the environmental development were one of the factors, or one of the multiple factors, that the Egyptian government tackled these problems through. Maybe through many initiatives and many presidential initiatives through developing the environment was one of the factors to eradicate these diseases. Also, I want to say that even in the the third edition of the Global Congress, maybe in 12 to 15 November, we have seen that the WHO also praised the health sector and the Ministry of Health for eradicating trachoma, which was one of the most and the ancient diseases that was causing irreversible blindness.
Yeah. Dr. Maryan, what about the measures taken by the government to make this achievement possible?
Yes, let me say that we are acting, and even the Ministry of Health, is acting through lots of pillars. One of them, the environmental development. One of them is the surveillance and studying the demographic dynamics, which is a very important policy in the health. If we study the dynamics of the demographics and understand the demographics of the population, it will be a very milestone, and it will be a very successful policy in tackling these diseases and eradicating these diseases.
Yeah.
So when I'm talking about the efforts of the Ministry of Health, we are talking about lots of pillars and lots of policies, and even the financing. I want to tell you that the financing increased from 40 million in 2014 to more than 409 billion of Egyptian pounds to increase the finance of the Ministry of Health. Also, I want to say that not even the environmental development, but we are working through a policy or working through a strategy. Even if we are talking about an example in the trachoma, there was a whole endorsed strategy called the SAFE strategy in order to get rid of trachoma and to make it eradicated from Egypt. The SAFE strategy was, it stands for surgery and surgery for tracheasis, antibiotic for treatment, and facial cleansing, and also environmental development. So through all these policies, I think this was the key of success to eradicate all these diseases, from the lymphatic filariasis, the trachoma. And by the way, the trachoma was the second non-tropical, neglected tropical disease. So getting rid of two tropical endemic diseases in the past decade was a very an achievement in Egypt.
And we want to talk more, Dr. Maryan, about the initiatives taken by the Ministry of Health for the Egyptian people?
Yes, we are talking about like 15 presidential initiatives. They were targeted to the youth and to the women and to the groups that were vulnerable to the risks of health.
15?
Yes, 15 presidential of course initiatives, and of course the top of them was Decent Life. Decent Life endorsed many policies, not only tackling the health problems but also the society, the social and the economic, by sharing and by integrating all the efforts from different ministries and different environmental and non-governmental societies and bodies. Actually, Decent Life made a lot of effort on the Egyptian soil, and we have even this is one of the important factors that we can eradicate disease. We can never eradicate such disease like trachoma or malaria without environmental development on all aspects of life, like society and economy. Of course, the public health is one of the Egypt's strategy to have a strategic strategy in human development. And of course the public health is one of the important, and even Prime Minister Mustafa Madbouli said that the public health is the way to build a strong economy, is the way to build a very strong society that can resist all the crises, either environmental or social. Yes, of course.
Dr. Maryan, how would that achievement mark a turning point in Egypt's health journey? I mean, a lot of initiatives and the government efforts to boost the health sector.
Yes, as I told you, maybe Egypt is not only caring about the health economic or the economics health. The economics health also is a crucial tool to build a diplomacy and to build an evidence-based decision. To have the evidence and to have the numbers and to have this policy is the way to build the policy and the diplomacy of the health. I want to also say to you that the diplomacy is the way for internships and for the partnerships between Egypt and many other countries. We call Egypt, they call it in the public health and the global health, it's very important in the equation of the global health security. We cannot ignore this, and it's a very important component in the health equation overall the world. Maybe because it's geographic place and its strategic place, and because of the civilization and the infrastructure, the new infrastructure that's being, and we are watching, or we are seeing in the health sector. Also this diplomacy is the part of the civilization bridge, and Egypt is acting as a civilization bridge between many countries and how to make a new policy and new partnerships. These partnerships is very important in transferring the experiences between the countries.
Dr. Maryan, during the opening session of the 3rd Global Conference on Health, Population and Human Development, Director General of the World Health Organization officially announced that the Arab Republic of Egypt is now free from trachoma as a public health problem. Tell us more about this.
Yes, as I told you, trachoma was one of the neglected tropical endemic disease, and by the way, it's ancient, like 3,000 years ago, and we were suffering trachoma as an infective disease. It's being transferred in the young children from 1 to 9 years old, and actually it was the cause even in the history in the French army of Napoleon Bonaparte. It caused many blindness, and it causes blindness in 1.9 million people in the population. So it causes irreversible blindness by causing tracheises and many eye problems. So eradicating trachoma was a must in this era, and of course many surveillance programs were made to get rid of trachoma. Many diagnostics and therapeutics issues and ways were done to eradicate the trachoma. So the program of eradicating trachoma began like 2 years ago, and of course there was many programs. As I told you, there was a strategy. It was called the SAFE strategy, in order to survey, to make a diagnosis in the children from 0 actually, from age 0 to 9 years old, to how to survey and to detect the numbers of those who were infected with trachoma, and to prescribe the medications needed, and also increase the hygiene awareness among people, especially in the rural areas.
Yeah, Dr. Maryan, the third edition of the Global Conference of Population and Health and Human Rights was launched under the patronage of President Abdel Fattah el-Sisi, and also with the presence of Prime Minister Mustafa Madbouli and Dr. Khalid Abdel Ghaffar, the Deputy Minister of Health. Tell us more about this conference.
Yes, it's the third edition of this global conference, and actually many expertise and many specialists from different sectors of the health sector were present in this exhibition or in this conference. And as I told you, it was a platform. Our assistant today, the last day, it's a platform for sharing experiences from different parts of the world, and this platform was very important to enrich the vision of Egypt, and also to expose the vision of Egypt and all the efforts to expose the health efforts that were done and that's being done, and the vision and the strategy of Egypt in human development. The conference is built, or it's discussing three important pillars, which are human development, expanding job opportunities, and of course the health and the advanced progress.
The theme was empowering people, advancing progress, expanding opportunities.
Yes, expanding opportunity and job opportunities in the health sector. Also, we cannot forget the smart digital exhibition. And here's the role of the artificial intelligence. Artificial intelligence is invading all the sectors and all the fields. And of course, we can make a good use of the artificial intelligence in the health sector by applying and by implementing the artificial intelligence in the medical decision, like the 3D construction of the face, in the face surgeries, in the smile design, in many sectors, and even the patients who lost one of their limbs. Also, the artificial intelligence can make a design which will be very compatible with the patients. And of course, this is the good use of technology, and this is the good face of technology in using it in our health sector.
Yes, of course. Dr. Maryan, could you please shed more light on the development witnessed by the health sector in recent years?
Yes, as I told you, in the past decade we have seen a new technology in the health sector in Egypt. Not only when I'm talking about the health sector, we are not talking about new infrastructure or new hospitals. Infrastructures and hospitals that is fully equipped is very important, but here we are talking another point, which is the medical personnel, the doctors, the paramedics, the nurses, which are very important factor in the success of the health sector. And of course, training the doctors and improving their quality and improving their expertise was one of the important points and one of the important efforts. Also, the digitalization and the digital transformation, which is a very important point in the health sector. Of course, we are being digitally transformed, and here we are talking about database. We cannot run a health sector in a professional way without digital transformation, without having databases. And let me give you a small example, that if a patient has the car accident, for example, or a road accident, and was admitted in a hospital in Alexandria, if he has an electronic ID, or if we have documentation about this patient who is living, for example, in Aswan, we can detect all the information or the medical data about this patient through the electronic ID or through the databases. This electronic ID, which I wish that will be implemented in the coming years, simply will describe and say all the data about his medical history, like which drug he is sensitive to, which blood type. Many things we can decide and we can detect from this electronic or this health electronic ID.
Yeah, Dr. Maryan, we want to talk more about women and women health. The majority of the society. Tell us more about initiatives in the Ministry of Health concerning women's health.
Yes, President Abdel Fattah el-Sisi was very keen on this initiative that tackled the women's problem, considering the prenatal area and the prenatal period and the postnatal period. Of course, this is an important point in the rural areas, because the prenatal and postnatal health is neglected in these rural areas. also the health of the women. We cannot have a successful society without having healthy women. Yes, of course. And I want to tell you that investing in the women's health, it's just investing in our economy with high productivity rate and investing in the economy for years to come. So investing in the women's health was very important, and there was an initiative targeting the early diagnosis of breast cancer. And it was very important because it's one of the cancers that's curable. Just early diagnosis is the key to have a curable and to cure the cancer and the breast cancer. So the Egyptian state is very keen on to have healthy women, and to even the awareness. I want to tell you that the health sector gave a lot of importance to the family planning, and which is a very important field, and family planning doctors are needed in the rural areas, and to spread awareness in order to keep the health of our women safe.
Yes, of course. Dr. Maryan, would you please tell us more about the most important issues on the agenda of the Ministry of Health, if you know the coming agenda?
Yes, of course, eradicating more communicable diseases are on the agenda of the health.
On top of the agenda.
Yes, of course. The communicable diseases, and as I told you, when we are developing our environment and we are getting more good environment with hygiene, so communicable diseases are to be eradicated soon. Also, maybe all the hospitals now are being renewed from the infrastructure, also the manufacturing of medicine, and this is one of the important aspects and field that was the Egyptian state that was very keen on to transform and to make the manufacture of the medicine and to make it locally over Egyptian soil, because it's very important even to avoid importing more medications and more drugs.
We want to talk more about the countryside and the initiatives specialized in the countryside.
Yes, of course, in the rural areas, awareness was the very first thing that the Egyptian state was very keen to deliver to our parents and our families in the rural areas. And as I told you, the women, of course, has the most bulky share from this initiatives. And also the children, children in the schools, many surveys were done on the children just to detect the reasons for blindness and the refractive errors and those who have short-sightedness or foresightedness. Also the anemia was one of the important, and it's very common in the children under 18, that you can find many children suffering from malnutrition and anemia. So all these initiatives in the rural areas was very keen, and through Decent Life, I want to tell you that Decent Life is
more
not
about this initiative.
Decent Life, as you know, was recognized by the UN as one of the most important and professional social practices, because it's not targeting just the health sector or the society or the services. We can say it an integrated initiative that was tackling all shapes of unhygiene and
for all members of the family.
Yes, and all aspects, not only the health.
Okay. And what about children? You just mentioned the children health. What about the initiatives for schools, the vaccinations? Tell us more about this.
Yes, of course, vaccinations is important, very important in the very early life, that we know even poliomyelitis, a disease like poliomyelitis, can be prevented through the vaccine. And of course, the vaccination is not through the surveys or not through the initiatives, but through the primary care. And the primary care is very important. I always say that the primary care units is very important than the hospitals even, because it's the unit that's in contact with our parents and our families in the rural areas, and it's the very first point that the patient goes through a triage process, and it can direct the patient either to a tertiary care or a secondary care or to whatever. Just the primary care units are very important, and for this the digital transformation targeted the primary care units in the very beginning. So we can say that the primary care units are totally digitally transformed by this time.
Dr. Maryan, we cannot talk about health system in Egypt without mentioning virus C.
Yes.
Egypt
is a role model in eradicating
we want
virus
to talk
C.
more about this. And
yes, as I told you, it's not just a sentence I said, but even the WHO organization and the UN recognized Egypt as a role model in eradicating the virus C. And actually Egypt was suffering from numbers of affected persons from virus C. Because in the 70s they were using a glass injection, the glass syringe. And the glass syringe actually caused the infection and caused lots of number of patients affected and infected with virus C. Yes, yes, of course. And virus C was a huge problem. But Egypt, I think, it put the policy, the right policy for eradicating virus C, and we succeeded through the past years to eradicate virus C. And when we are saying that, this is a very important point, when we are saying we are eradicating or this disease is being eradicated, it doesn't mean 0 cases. It just means that less than 5%. Just like trachoma and other. Yes, less than 5%.
To the past.
Yes, less than 5% is not in an infective state, and it's not a mass problem. It's not a problem over in the health sector. And for this, it's being a role model in eradicating the virus C. This policy was transferred and was exported to all countries of Africa. And I think now Egypt is very successful in exporting its policy as a policy to follow in order to eradicate. And also, I remember that 1 million of African people were having the access to be treated from virus C.
Yeah, indeed. Dr. Maryan Guirguis, a journalist, thank you very much for coming to Nile TV International.
Thank you. It's my honor.
Thank you. And moving to our local news, Prime Minister Mustafa Madbouli witnessed on Friday evening the inauguration ceremony of Al Fustat Winter Festival 2025. Before the ceremony, Madbouli witnessed the signing ceremony of an agreement between the Urban Development Fund and Azza Fahmy Foundation for Development of Handicrafts and Traditional Industries. Let's watch.
Prime Minister Mustafa Madbouli witnessed on Friday evening the inauguration ceremony of Fustat Winter Festival 2025, which is held at Fustat Hills Park. Before the ceremony, Madbouli witnessed the signing of an agreement between the Urban Development Fund and Azza Fahmy Foundation for development of handicrafts and traditional industries. The agreement came to establish an integrated cultural and training center for teaching handicrafts in Darb el-Labbana area in historic Old Cairo. Fustat Hill Park project aims to add 500 fiddans of green space to the Old Cairo area. The park is considered one of the largest of its kind in the Middle East and features a wide range of activities celebrating Egyptian heritage across the different eras. Organized by the Urban Development Fund, the Winter Festival is themed Fustat is Back Again and was launched from the Arena Theatre of the park. The festival runs between November 14th and December 3rd, featuring concerts by leading Egyptian artists.